The Northeast Georgia Medical Center hospitals in Gainesville and Braselton are treating more people for the virus than ever before. One of its administrators tells Reveal investigator Andy Perotti what it desperately needs to keep treating these patients.
We're pretty busy right now.
Dr. John Dizel is leading the COVID-19 response at 4 Northeast Georgia Medical Center hospitals. His facilities in Gainesville and Braselton at a breaking point, nearly 100% full.
As we start to reach our capacity with our hospital and our critical care beds, that becomes a concern because those patients don't have anywhere to go.
In June, Hall County averaged about 23 new COVID-19 infections a day. So far this month, it's more than doubled, and hospitalizations have followed suit. To help, the state built this mobile medical unit outside its Gainesville facility in May, adding 20 more beds. But now it's not more space that's needed, it's medicine, testing, and critical care staff.
We can create more rooms, critical care beds, that kind of thing. But if we don't have nurses, if we don't have respiratory therapists, if we don't have the physicians to take care of them, that doesn't really help us much.
Dr. Dizel says his hospitals need more remdesivir, which has proven to be an effective treatment for COVID. More testing would help too. He's worried not enough people are taking the virus seriously.
Stay at home. Don't go out. Wear your mask. It's real and it's concerning.
Dr. Dizel says he's also concerned for his medical staff's mental health, not their ability to do their day-to-day duties caring for patients, but their inability to see a light at the end of the tunnel for any relief.